Well, now on your feed at 5, Ohio's third case of monkeypox is in a Cleveland resident. The city health department announced that it's working with the Ohio Department of Health to reach out to the patient's potential contacts.
To explain more about this and what we all need to know, we bring in our senior health correspondent, Monica Robbins. Monica, good afternoon to you.
Good afternoon, guys. You are more likely to get COVID than you are monkeypox. I want to start with that right away. While it is not common, monkeypox is not new. This strain hasn't been fatal. Those are important facts to keep in mind. Now, the Cleveland Health Department says this individual had limited contact to people in the last 21 days, but it's very important to remember monkeypox is simply not easy to catch. Infection relies on direct skin-to-skin contact, or you need to be in very close contact for about 3 hours for a respiratory droplet infection. Incubation is about 1 to 2 weeks after exposure. Symptoms include a painful rash and bumps that look like blisters.
First of all, it is incredibly low risk to the general public, right? It was one patient with very limited contact with others, and definitely we are doing our contact tracing, and there have been no signs or symptoms shown in that.
Now, we do have vaccines and treatments for this, but it is not something you can just ask your doctor for. The shots are for those at high risk following a confirmed or presumed monkeypox exposure. This includes those who've had close physical contact with someone diagnosed with monkeypox, those who know their sexual partner was diagnosed with it, and men who've had sex with men in an area of a monkeypox outbreak. So that's what everybody needs to know. Calm down. We're going to be okay. And, you know, wash your hands, wash your hands, wash your hands. That's what I got to tell everybody.
And it's a very different scenario than with COVID, which you mentioned you're far more likely to get. Do you have any updates on the vaccine for COVID for us?
Something just happened this afternoon. Today, the FDA followed the recommendation from its advisory panel and called on vaccine manufacturers to include Omicron in the booster shots for fall and winter. They want them to add that Omicron B4 and B5 to the vaccines that would also include the original strain. And if all goes according to plan, they should be available by early fall. But who is going to get them has not yet been announced.
All right. I'm sure you'll keep us up to date.
Sure will.
Monica, thanks.
Sure.